Hi, this is Dr. Kim. I want to talk about optimizing your child's health with LDN. And the LDN has been, or low dose naltrexone, has been a great tool in my practice. And children are near and dear to our hearts. I have a child, and it's just very different helping children with LDN. So the pediatric dosing guideline for an LDN is very straightforward. They say about start with zero point 0.1 milligram per kilogram per day, and you can go as high as 4.5 milligrams per day. And the studies have used anything between zero point 0.1 milligram to 4.5 milligrams per day, and usually we titrate. And the side effects are similar to adults: vivid dreams, fatigue, um, and they have used it for Crohn's disease. They did a pilot study aged 6 to 17 using the dose of zero point 0.1 milligram per kilogram per day up to 4.5 milligrams, where 67% showed clinical improvement with excellent safety and tolerability. They also have studied for autism spectrum disorders using zero point 0.5 milligram to 2.0 milligram per kilogram per day, and they have seen improvements in speech, focus, and behavior. And what's interesting is dosing of higher doses that's greater than 1.5 milligram per kilogram per day. Sometimes the results were not as good. So the thing that I want to talk about the most, I think, is that in pediatric population, um, because children are the reason why the parents work very hard, and children are the reason why um, they are near and dear to our heart. And I have raised a child with my spouse, and when they're not well, really nothing in our world seems to be right. So I have developed a different approach than what they recommend, what I just talked about. That's the academic book record of how is recommended. But really, how I do it is a little different. What I do is I start with 1 microgram, and then I titrate it up, meaning 1 microgram every day times 7 days, 2 micrograms, 3 micrograms, 4 micrograms. After that, 10 micrograms, 20 micrograms, 30 micrograms, 40 micrograms, 100 micrograms, and so on and so forth until 4.5 milligram or the zero point 0.1 milligram per kilogram per day has been met. Why do I start so low on children? It's because we want to be careful with them, and I think that the kids that, and judging from my adult population, my actual patient population seems to be even more sensitive than the research study population. And I had a patient with myasthenia gravis that did fantastic in microgram dose, and I think the person would do even better in higher dose, but parents just did not feel comfortable. And I think that one of the things I learned from in pediatric subspecialty when I was doing rotation was that the lowest dose with best result is the right dose. So, and that is kind of my approach that I've learned after using LDN for 20 years in my practice in integrative functional and lifestyle medicine. This is Dr. Kim, and if you have any questions, I'll post it. If you have learned something, or if you like the video, give me a like. Thank you.